Good evening, I'm Chris Ensing, and this is the digital version of CBC Windsor News that we've been broadcasting as we are amid the COVID-19 pandemic here in our community. We want to bring you the latest updates of what's happening here. We remind you again that our updates are available at cbc.ca/Windsor. The major news that broke this afternoon is a third case of COVID-19 confirmed by the Windsor-Essex County Health Unit. This is for a man in his late 40s who lives in Windsor-Essex and works in Michigan. Now, that's very familiar to what happened this weekend. You'll recall on Friday is when the other two, there are 3 confirmed cases in Windsor-Essex, and it was late Friday, when the first case was confirmed. There's also a second case, another case, a man who works in Windsor-Essex who was doing maintenance work at the Southwest Detention Center who's been confirmed positive for COVID-19. This recent case, the man developed symptoms on March 15th, was tested at Windsor Regional Hospital's Assessment and Testing Center. The Windsor-Essex County Health Unit was notified on the positive result on Monday, that's earlier today. And they have let us know that close contacts of the client that resides in Windsor-Essex have been contacted. They're self-isolating, and currently this third and new positive COVID-19 test has been staying at home, self-isolating and recovering. And that's true with all 3 of the cases, which is important to note as we talk about the stress. We hear about flattening the curve and what's going on at Windsor Regional Hospital and hospitals all across Ontario, all across Canada. Very important that we continue to update you on where these people are recovering. And for now, those 3 cases that have been confirmed in Windsor-Essex County Health Unit, press releases over the weekend, they are recovering at home. Another major announcement as well, Ontario will close all non-essential businesses as the province confirms that there were 78 new COVID-19 cases today. Now that is in line with what the health unit had put out on the weekend. You'll remember that state of emergency that was declared by Mayor Drew Dilkins, which allowed for the temporary closure of Devonshire Mall and Tecumseh Mall. Well, now that's something that's happening across the province here, and it's something that we have details on our website, cbc.ca/Windsor. But it is important to note, while all of this is happening, that call from food banks as well for people to donate. CBC's Jacob Barker did a story on this, talking about how locally here there are some food banks that have about 10 days worth of supplies, and they're going to need more in order to help people. They're saying that they are seeing an increase in the need, the demand for these services as well. We'll continue to update these stories on our website, cbc.ca/Windsor. But for now, I want to come over here. We've been doing something a little bit different here. We just Skype with some of our reporters. As I said, our show looks a little bit different than it usually does. You can see here, this is our reporter, Jason Vio. Jason, you're live now. We've got you from your home. I guess just to bring you in here now, you were looking at the hospital today and giving us an update on what they're seeing. What have you found out so far?
Right, Chris. So we're hearing that healthcare workers who have returned from trips outside of Canada are actually working at the hospital without that 14-day self-isolation period that we're hearing about so much. But there is a reason for that, and the hospital CEO did walk me through why that's happening. Certainly if they're sick or they have a fever, they are staying home as they would if we weren't in the midst of this pandemic. But we do know that they are needed, so they are being allowed to come back to work even if they've been outside of Canada within the last 14 days. So right now, Windsor Regional Hospital has more than 300 employees who have been outside of Canada within the last 2 weeks. And today, for example, 30 of those people were at work because their function, what they did, was critically important to help the operation of the hospital. And each day they say they do kind of a risk assessment to see who's needed, who's not needed, who can stay at home, that type of thing. So 30 people today were working, but have traveled outside of Canada within the last 2 weeks, again, not showing any symptoms. And they say that mostly happens in the emergency department and the critical care units. And that especially applies to specialty healthcare staff. So people who would be really hard to replace or impossible to replace. So they're really needed to help out with patient care. The hospital's CEO, David Mouche, told me today that they are taking extra precautions with those people. So they're wearing protective gear, gloves, masks, even if they're not working in the assessment center, as I mentioned. And they're also being checked for a fever or their temperature at least twice a day while they're at work. But he also says this is something that the provincial health authorities have allowed. It's kind of an exemption within that 14-day isolation period. So it's not something that's unique to Windsor. It's something that's also going on right across this country. He says if we didn't have these staff working, if they were at home for those 2 weeks, for that 2-week quarantine period, and even though they weren't showing any symptoms, patients would suffer. So he says it's kind of all about balancing the risk. But he says moving forward, if there is a surge in patients, we could see some more of those 300 plus people return back to work as well.
Jason, this has been a big story for us locally here. The calls that come into our office of people concerned about whether people have enough personal protection equipment when they are going to work. What else have you found out today in your reporting as you continue to follow the story?
So we're hearing, not just in Windsor, but at different hospitals across the province as well, that they're asking the community to kind of come together and donate personal protective equipment if they're able to, or businesses that have shut down that have some that aren't using it to donate it to the hospital. Now, a few weeks ago, you'll remember I told you about a pandemic supply warehouse. That's something that Windsor Regional Hospital has off-site with medical supplies and different things for a situation exactly like this, what we're in right now. And as of today, the hospital CEO said they have about a month worth of supplies left in that pandemic supply warehouse. So they want to get ahead of this. They're asking for donations. They're still sourcing out what they normally would, but it's becoming increasingly difficult to get their hands on some of these things as everyone needs and wants this protective equipment for obvious reasons. So they're asking the business community to come together and donate these things. We're talking about masks, gloves, disposable gowns. There's more than that as well, and you can find the full list on our website, cbc.ca/Windsor. And in our case, the city is kind of helping coordinate this, so it's not only going to help frontline healthcare workers in hospitals, but also paramedics, firefighters, police officers, jail guards, and those working at long-term care homes as well, Chris. So there's a need for this stuff. They say they have enough for about a month or a little bit longer, but they just want to be prepared and have more on hand.
All right, good update here. Good look at what we've been dealing with and what we're going to see in the future here. We can follow you on Twitter as well. The best place, I guess, for these recent and developing situation.
For sure.
All right, thanks, Jason.
Thanks,
I'm going to hang up on Jason here now, not to be rude. We're going to see if we can't get our Tamina Aziz, who's been looking at construction workers and construction sites inside of the community. There's also been a call about whether or not that's safe. We heard from Doug Ford, the Premier of Ontario, asking people to get their act together. Not necessarily the people who are working, but noticing that some of these construction sites weren't exactly reportedly in the most hygienic of conditions here. Another update that we want to bring to you as well with everything that is going on. We heard about the border closures. Those took effect on Friday night. Those are for essential workers only. And what we can tell you is that there is a more extreme measures being taken across the border, especially for those that border the American states that border with Canada. Michigan specifically telling people to stay home in order to curb coronavirus. The governor there issuing a statewide order hoping to try and stop the spread there. We've seen the number of deaths and the number of infections rise. As of this afternoon, there were more than 1,000 cases of COVID-19 in Michigan. And we can once again remind you that Windsor-Essex County Health Unit has confirmed a third positive COVID-19 test. And that is for somebody who worked in Michigan and lives in Windsor-Essex. It was certainly the focus of what we were dealing with when we were talking about the border closures, who exactly would be exempted and why they would be exempted. Healthcare workers and essential workers, again, with the Michigan order, have been allowed to continue. And in Ontario, we're seeing now that call for businesses to close. The health unit was asked earlier today about why that stay-at-home order hasn't been issued here locally. And they just felt that at this time, it wasn't what needed to be called for. Those daily briefings are happening at 9 a.m. every single morning. They're sharing them on the Windsor-Essex County Health Unit page. And we can, of course, provide you the updates online. Our radio show, as well as another place, Windsor Morning. Tony Doucette and the team have really been rocking it there. And it's also where we heard from Mayor Dilkens today, talking about the need that you just heard Jason speak about as well, that desire for more personal protection equipment. So those N95 masks, you heard him talk about that warehouse and that desire to stockpile and only being a month left. Well, there was also that call from the Automotive Parts Manufacturer Association, Flavio Volpe. I was speaking with him last week, and he talked about how certain manufacturers are starting to twist into different industries. And one of those industries is the healthcare industry. Just before we came on air here today, I was able to speak with Kevin Taylor. He's with Kelcom, and I asked him what they're doing, and it's really interesting what he's been able to pull off. You've probably heard of 3D printers in the past. What they've been able to do is, through a design from the Czech Republic, they went online, downloaded it, made a couple tweaks to it, and have been able to print off a face shield. So if you think of a welding mask, we'll share those photos on cbc.ca/Windsor, but if you think of a welding mask that's clear and see-through, that's the type of stuff that's being developed locally here and printed locally here. Now, when I spoke with him, the one thing that he had mentioned that was super interesting is the idea that he thinks this is good enough. He talks about it as a bridge gap measure, these 3D printings of personal protection equipment. It's not necessarily what people would be using as their first choice, but in this type of a crisis pandemic situation, he says that there is an opportunity to build these as a bridge measure in order to get these in the hands of our frontline workers until the manufacturing industry can start retooling the lines and then producing them at a rapid pace. The one concern that he does have, though, is the idea of where you get the supplies to actually start printing off those masks. And that is stuff that he says is usually shipped in from China. So as you can imagine, the supply chain there has certainly shifted because of what's happened with COVID-19 over on that side of the world. And it's also created a bit of a backup over here. He says there might be a desire in the future for some local company to start producing the actual material that these 3D printers are using to make these kinds of face shields, which is certainly something that we'll be following closely. Another story that we want to let you know about is about what's happening on Pelee Island. I know personally it's been something that I've been thinking about. An island seems like one of those spots where you might be able to have a better chance at stopping and preventing the spread of coronavirus as COVID-19's pandemic continues to sort of envelope every conversation that we have. I spoke with the Pelee Island Co-op today, and what they said is that they're noticing a sense of pride on Pelee Island, people looking after each other. They did declare a state of emergency this afternoon, which has put them in a position very similar to what Essex County, the leaders and mayors at places like Amherstburg and Leamington had done on the weekend, of declaring a state of emergency, which allows for more access to different funding provincially, as well as finding ways to change bylaws and incorporate some of the new restrictions that are in place. So Pelee Island also now in a state of emergency. The ferry service is set to return on April 1st. Now that's still going ahead, but there are discussions with the Ministry of Transportation of Ontario to see if that type of a ferry system will have certain screening in place to ensure that non-essential travel isn't happening. A reminder that public health officials are telling us to remain home if possible and to avoid that non-essential travel. So certainly the 150 or so people that call Pelee Island home full time, many of them 60 or older, are wondering what will happen next there. My conversation with the deputy mayor there, Dave Dawson, reflected a lot of thoughts on what to do next in that situation because of the unique opportunity that site might have, that community might have, to prevent the spread, but to also stop it from potentially coming over. Now, at this time, no cases of COVID-19 on Pelee Island. The co-op still has plenty of stock on the shelves, but they are noticing the ripple effect of what people are so-called panic buying. When you go to the grocery store and you see that there's no toilet paper. Yes, there's toilet paper on Pelee Island. You can go to the co-op and grab some. But they're noticing that when they put in their requests for their next load, their next order, they're seeing a not 100% fulfillment on that. So things like milk, eggs, bread, they are seeing that it's not exactly 100% coming through. But they do have enough stock, and they are finding that people are leaning on each other to make sure that if they have bread, they don't buy what's at the store because they know that their neighbor is going to need it. We'll have that web story online at cbc.ca/Windsor, just to look at how a very specific community, Canada's most southern community, is dealing with this pandemic of COVID-19. Another big deal here is the idea of what exactly is going to happen moving forward with those benefit packages. We do understand that the House of Commons is being called back to start pushing those packages forward. That's $82 billion in financial relief as first announced last week from Prime Minister Justin Trudeau. And it's something that we're keeping a close eye on here as well. Another thing that you're going to want to listen to tomorrow morning with Windsor Morning is how exactly the changes to the Olympics are coming through. Late last night, Canada said that they will not be sending our athletes, our coaches, to the Olympics or the Paralympics. Now, we have some pretty heavy hitters in our region here, and we're going to hear from one tomorrow who not only was set to compete in the track and field portion, but is also herself a nurse. And so it's a very unique perspective of what this decision means for her in her athletic career, but also from the healthcare side of things. That's the latest news that you need from us here at CBC Windsor. We're continuing to develop continuing to provide the developing story on our website and our other platforms as well. cbc.ca/Windsor for those. And again, you're going to want to pay attention and listen to Windsor Morning tomorrow with Tony Doucette for a full update on what's expected to be a very difficult time for some of the Olympic athletes in our region. That's it for our digital show tonight. Thanks for watching.